This is Boomer Life on CL 650.
When it's sleepy time down south. Yes.
Hey, and welcome back to the show. You're listening to CL 650, and we're speaking with Dr. Charnel Muir, the SnoreDentist based in North Vancouver, and the website is SnoreDentist.ca, and you're based in North Van.
Yes. All
right. Now, you must be over the moon and excited about Matrix Plus. So give us the 30,000-foot view. What is Matrix Plus? We also have Dr. John Remmers on the phone here from Calgary who developed this product. So what is it going to mean for your practice?
You know what? I think it's just going to add a totally different dimension for not only patient confidence in care, but also patients being able to feel what it's like to have a proper night's sleep. Imagine you're wearing a monitor that might be a little disrupted to your sleep, but finally you can breathe because that monitor now has the ability to adjust the bite or temporary appliance that's in there so that you're finally breathing through the night, and that waking up that next morning and realizing, wow, that was a good night's sleep, despite actually wearing this monitor. And the monitor is not all that invasive.
No.
It's relatively simple to wear, and it's small. And the monitor that's on the belt around your chest is no bigger or even slightly smaller.
It's about the size of a smartphone.
Yeah.
It's not very big.
And, it's connected to the bedside monitor by Bluetooth, so there's no wire to your bedside monitor. The temporary bite itself, as I mentioned earlier, the computer will have the limits of forward and back. But, as Dr. Remmers was saying, it's going to enable that patient to wear something. It'll enable us to determine their therapeutic response position. And it will enable me to treat a patient at the absolute minimum necessary position. So we're not going to have any over treatment position or any extension of the jaw that wasn't needed.
So this is a major change for you.
Yes.
Because you'd have, it's I don't mean to sound as crude as trial and error, but you're going to try something for a while, then adjust and try.
Well, and for a lot of my patients, when they come in and get their oral appliance records taken, when we determine where their bite registration should be, it's based on averages. The average patient will be treated somewhere between 30 and 100% of their range of motion. If they're going to be a responder, it'll be in there somewhere. So based on any number of things like severity of what we're treating, jaw, overclosure, crowding of teeth, any of these things will help us kind of decide where we should start the appliance. But then we have to walk it out step at a time based on repeat monitors, subjective reports from bed partners, whereas now we know that position. We have a computerized readout of where that patient is the best responder, whether they are a true responder, a partial responder. Say a patient comes in, they're CPAP intolerant, and now we can show, well, you are a responder to oral appliance therapy, irrespective of your degree of sleep apnea.
So, Dr. Remmers, you developed Matrix Plus, and when did you start doing your clinical trials with this new test that adjusts your jaw as you're sleeping?
It was quite complicated in that we first carried out a group of studies on 130 patients. We had to train the computer to actually understand and predict the outcome with the custom appliance. And then we did another 50 patients after that. So it's been a 3-year process of developing that. And but this is just the beginning, Zach. I imagine in 10 years, it's not going to look like this at all. It is going to be, you'll order up your test on your cell phone, and a little appliance will come, and you'll put it in your mouth. You won't even have to see the dentist, perhaps, and your cell phone would do all the work. But this is the major breakthrough here. Now we have a way for the very first time, to understand whether somebody is going to respond nicely or partially, however. But in addition, we know just where to set the mandible. It's like for the first time we know we have a drug that works, and we know how much of the dose to give. No more guesswork.
Can you see a time in the future, that 10-year period you mentioned, where your oral appliance will be automatically adjusting through the night?
That was a patent that was submitted 10 years ago, Zach, and we aren't working on that right now. But yes, I feel it will. I may not be around to see it, but it will happen, and it'll be analogous to what we call a smart CPAP or an auto CPAP, where the pressure is adjusted throughout the night to meet your needs. I think we'll have the same thing here. But that's a twinkle in the old man's eye for sure.
Because I'm just thinking, you're adjusting the oral appliance through the test cycle. I can imagine, taking that out 10 years, it could be done automatically. But Dr. Muir, so Matrix Plus is coming to your practice first, is that right?
Yeah, we're just in the implementation stage at this point. It has gone through and been approved by Health Canada for use. So we're just in the process of trying to get that all organized and set up, and we hope to have it in the office within the next few months.
So, Doctor, go ahead.
I'd like to just interrupt and say I want to compliment Dr. Muir on her courage and her wisdom in moving ahead in this area. It's a real sign of the level of care that she provides to people with sleep apnea. And I've always known it was outstanding, but I can tell you this is really absolutely the tops. You'll find no one better anywhere.
Oh, thank you, Dr.
Anywhere.
Rivers.
So with the test, you're going to be able to find out how much you're snoring, how much apnea you maybe suffer, and then the adjustments that go on. So for you, are you going to be able to then take this and do this test again, maybe a year or so later, to see if there is a farther adjustment that needs? Because as we've discussed in previous shows, typically this is something that progresses as you get older, right?
Right. So one of the things that I think I'll probably be maintaining in my practice is the true diagnostic test. Mm-hmm. So we'll still be doing a true separate diagnostic test that will set our parameters for what it is that we've got, what we're treating, and where to go from there. And then the Matrix Plus enables us to do a 2-night study and possibly a third night initially, but for sure a 2-night study. And we have a dynamic study and a static study. So those are the 2 studies that are done with the temporary appliance. One is the dynamic night, where it's moving the lower jaw within its parameters so that we can determine its therapeutic effectiveness at different positions. And then the second night, the patient just keeps the monitor at home, and then they wear the monitor the next night at the ideally set position that the computer has determined.
The second night it's static.
It's static.
Right.
Yep.
So that will give us the true response of the patient at that idealized position. Now, it also has the ability in the static night to still do fine-tuning. Mm-hmm. And there can be a second static if the computer determines that there may be, in fact, perhaps a less forward position that it has calculated. We could do a second static night at a different position. So it really, truly enables us to fine-tune that response of that patient at the ideal position. Once that's done and the appliance is made, most patients, the vast majority of patients, can be initially started at their most therapeutic position. Mm-hmm. Now, some patients, if their range of motion of their jaw has them starting out maybe 75, 80% or more of their jaw range of motion, then we may start them at the slightly under that and walk them forward to that ideal position. But we already know where the ideal position is, so we're just going there slowly.
Why would you want to do that?
Mainly because we just want the patient to be comfortable in the appliance.
So that's the great thing about this Matrix Plus test, is that you fall asleep where it's comfortable, and it's moving while you're asleep, so it becomes, you're not aware of it.
That's correct.
Yeah. And then as we follow up patients annually, we always have that ability of repeating that diagnostic test that we did to make sure that we still have the appliance being effective. Yes.
So today we're speaking with Dr. John Remmers, who's based in Calgary, talking about Matrix Plus, a new test that has, I don't know how you would describe it, a dynamic system in your mouth to move your jaw and to get the best possible airflow to reduce snoring and help with sleep apnea. And Dr. Charnel Muir is here, the SnoreDentist, and this is where the test is going to be available, the first in Canada in North Vancouver. And we'll continue our conversation next on CL 650.
Celebrating the baby boomer lifestyle. This is Boomer Life on CL 650.